Hi, this is Walt Fritz from Foundations and Manual Therapy Seminars. I want to present to you a class I'm going to be teaching next year, 2026, in Limerick, Ireland. The class is going to be on September 19th through 20th, 2026 in Limerick. And if you're not familiar with me, I'm a physical therapist in the United States. I've been practicing and teaching manual therapy for decades now. My work started out both as I learned as I taught, myofascial release. But over the years, I evolved that title, that mindset, into a more general manual therapy. And the reason I did that is to more accurately represent all the possibilities on what's occurring when we touch, when we use manual therapy, whether it's for more general issues or some of the conditions and problems that we talk about and deal with in this two-day seminar. This seminar was originally designed for speech pathologists, speech therapists dealing with voice, swallowing, airway, oral motor, tongue-related, and breathing issues. But it's really expanded into a lot more than that. We get a tremendous variety of professionals and clinicians attending the class, including voice coaches, dental hygienists for myofunctional work, physios, occupational therapists, osteopaths, chiropractors, and MDs, all coming for different reasons. Some just to learn this approach of what we're doing here in the throat, in the mouth, in the tongue, etc. Others come for my style of teaching, my style of engagement, which is rather unorthodox when it comes to manual therapy, in that instead of feeling like we need to be an expert to find that whatever pathology your school, your model calls that, what we're doing is using the patient to build an alliance, a therapeutic alliance, and having them help us help them. Shared decision making is the specific concept we're talking about, and I instill it throughout all my work, both as I teach as well as here as I teach or treat patients in upstate New York. So this class is coming up, Limerick, September 18th, 19th through 20th, 2026. Registration is available. Information is available on my website, waltfritz.com, and I'm always eager to hear from you. If you have any questions, just reach out to me through the website or social media. I tend to use the upper teeth as a resting place for my finger to then move into that gap. Also, I should have showed you on there, I can also come up there. And then I'm going to lay two fingers just below it. And then these fingers go right over those. Now, listen to my voice as I pull down, all right? I'm going to pull my skin down. The skin like that. What I'm going to do is come in with hand over hand. Now, Heidi, do you feel that anchoring downward? I'm coming in above or higher, right? That's nice. Just like, shut up. Just like, I got stuff to teach here. What I did, I just came in above and I gently dropped down. I was above or higher right there, and then she said, that's nice. And it does, okay, to me, down. In fact, I can slow things down, and here's where I get Walt's version in here. I can slow things down to the point where we actually stay. I'm doing to this tongue here, right? But then the addition of the hook is, while I'm pulling out, I'm engaging. And you can see what happens in terms of the line. It's just going to capture it, and it's a very subtle movement like that, right? You're going to see me twist my hand from side to side. That's the only way I can get one side versus the other, okay? So I'm going to have you, let me get under, or slow micro motions. I'm going to now elevate. And it's just that little bit of a rocking motion. If I want to try one side down, and I'm going to compress all the way down again. Now, my fingers right now, they're not doing that. Harder, harder, harder. Good. Now I'm going to come in the other side. I'm going to shove her tongue to the left, and now move your tongue to the right. Push against resistance. Push, 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 push. Good. You're not actually doing this. It's as if you're pressing them together like you want to pinch the esophagus. You better not be. That's a long around. It's pretty gentle. You will over push in the beginning, but once you get an idea where these bones are, you don't have to keep pushing so hard. Now put your finger on your thyroid notch. I'm having Heidi put her finger on the thyroid notch. Popped out on him right there, right? So I would get my fingers here. There's the bone. Now slow. Good. Slow. Would you do me a favor? Could you place your hands over mine?
で、私の手の上にこう乗せて押してもらえますか。
And show me what you'd like.
で、やりたいように動かしてください。
Yeah, yeah.
She modified.
This is unilaterally.
Come in. Uh-huh.
Like that. Okay, and then like that.
There you go.
Okay. Okay.
Okay.
And then if I did.
Because what I really wanted to do when she started telling me about all this stuff was immediately go off script. And spend, I don't know, about 14 hours here, maybe.
Course is only that.
I know, that's true. Okay, so I'm going to behave myself. Okay, thanks for the reminder.
Emily, are you doing it?
What do you feel?
More tension on the left. So.
Yeah, and that's relatable?
Mm-hmm. Yes.
Is it okay if I put my hands on you in that area?
Mm-hmm.
Okay, got it. So this is how I learned the technique originally, where you kind of come in like this, and using web space here, I'm going to come in on the area, well, first rib sits right here, second rib sits right here, kind of the first and second ribs. And I'm giving, you know, kind of an inward and downward diagonal type of stretch, pressure. Can be useful. And over the years, I've done all sorts of variations on it, right? Especially if they like that more focal, aggressive, like right in there feels kind of gnarly. Yeah. By the way, that thumb numbness when I'm doing what I was doing is not at all a surprise. The cervical nerve roots, when they pass out the neck, they pass right through this area, under the collarbone, down in the brachial plexus, and into the arm. Super common, right? But what I'll do now is, what I want to do, Janet, is with your permission to be able to get my hands up and under your shirt sleeves, so my hands are resting right here on the front of your shoulders and upper chest.
Yeah.
Are you okay with that?
Yeah, sure.
Okay, good. And again, remember, I always work in front of that full-length mirror. Once I squat down to where I'm going, I can't see anything. I can't see her, but she can at least see, okay, see where his hands are. I know where he was back there, right? I like to have as much of that safety as possible. I'm coming up underneath, but what I want to show you is what I do with my hands under her shirt. This is one where I do feel it doesn't work as well over clothing as it does under clothing. Okay, so but what I want my hands are right in through here. The heel of my hand is sort of medial to the ball of the shoulder, so that it's almost like a speed bump that the shoulder acts as, and I'm a little bit of a snowplow coming down, and it gives me that little bit of ability to hold on better, okay? So what I want to do is come in and under. I'm going to come on the front, and there's my fingers. And what I'm doing is coming behind the sternocleidomastoids, and I'm finding the anterior transverse processes of the spine, and then I move medial. And as I move medial, what I'm looking for is to, essentially on my fingernails, the tips, I'm trying to get behind the thyroid cartilage, and as we move it anterior, I can't hear you.
She's talking.
Okay.
Got it.
And you heard her?
Okay.
There we go, like that, and out. And I'm going to come in again, and you can see the reaction. Again, this isn't proving anything, but as I do this,